Hi, my name is Rachel Hamilton, and for my evidence-based practice presentation, I focused on telemetry monitoring. So problem associated with telemetry monitoring includes alarm fatigue, having inappropriate telemetry orders placed by providers, and nurse uncertainty when it comes to interpreting rhythms and acting and responding to rhythms. Drew and her colleagues had a study, and they acknowledged that alarm fatigue serves as a threat to creating safe patient environments. From personal experience, I work on a unit that utilizes telemetry monitoring and find that I am frequently dealing with alarm fatigue. I also find that the alarm can be going off for a little bit before somebody has the ability to respond, and that people become used to having false alarms. So that's definitely an issue that I face in my practice. So the purpose of this presentation is to identify issues associated with telemetry monitoring, review and analyze current literature, and to examine potential changes in healthcare, stuff that can occur to help with these problems. So the research question is, in adult hospitalized patients, how does the absence or proactive discharging of telemetry orders prompt nursing interventions for cardiac arrhythmias compared to initiation or renewal of telemetry monitoring? So the population here is adult hospitalized patients. The intervention is the absence or discharging from telemetry. The comparison intervention is having initial monitoring and renewal of telemetry monitoring orders. And then the outcome is decreased alarm fatigue and prompt care of patients with cardiac arrhythmias. When looking for literature, databases were used such as Academic Search Premier, along with looking at articles and looking at the reference sections about certain articles that were used to see if they were appropriate for this literature review. Subject headings or keywords that were used were telemetry, nursing, and alarm fatigue. The criteria was that they needed to be less than 5 years old, they had to come in full text, needed to be peer-reviewed, and also that they needed to be research-based. So when looking for these articles, there was definitely an abundance of articles, but there was definitely a lot that dealt with quality improvement, so that was a challenge at times. So the one study is Drew and her colleagues, so they observed alarms to determine common themes associated with alarm fatigue. The sample size was 461 adults in an intensive care unit. This was an observational study. It determined the causes for alarms. The results showed that they had 2,558,760 alarms during the 31-day study, which is just insane, and that there was a lot of data that came from this study. However, they found that the false positive alarms for the arrhythmias was 88% of them. So that is a large amount of alarms going off that really mean nothing. And then the Xarian article, her study observed nurse response to cardiac monitoring alarms. So for this study, it was much smaller than the Drew study, but there were 9 participants. It was also an observational study, and they watched nurses respond to cardiac monitoring alarms. They found that nurses responded to 46.8% of alarms, and that they concluded that monitoring and managing alarms is very difficult for the nurses. The next study was by Nakash and colleagues, and they observed nurse confusion with monitoring. And again, this was a smaller sample size as well. This was 11 participants. It was a qualitative study. They utilized a survey to grasp a better understanding of how nurses feel when interpreting telemetry rhythms. And they found that nurses reported feeling confused and uncertain, feeling out of their comfort zone, and also feeling a loss of independence. And that was because of having telemetry technicians also involved in the process. So this Cantillon article and study evaluated outcomes with utilizing a central monitoring unit. They had a large sample size that looked at over 99,000, and it was a quantitative study tracking the monitoring, and the results showed that there was a reduction in the amount of patients that actually were monitored over time, and that it prompted early detection. So while the Nakash article found that nurses sometimes feel like they lost their independence, this article shows that there is a benefit for central monitoring and that it will reduce the number of patients that nurses have that are monitored and can also promote early detection for these patients. Then the fifth article by Sharma and colleagues explained that, or they looked at examining physician awareness of telemetry monitoring. Again, another large sample size at 870 assessments. It was quantitative. They measured the medical provider awareness of patients that are currently monitored and found that the assessment for physicians knowing if their patients were on it or not was inaccurate and at 26%. So this shows that physicians are not always aware of which one of their patients are actually being telemetry monitored, which is a problem because it indicates that some patients may be on telemetry when they don't need to be on telemetry. So these articles differ in different ways at their subject size, their approach, but what's interesting is they all have a similar goal, which is focusing on telemetry and its indications and how nurses feel about interpreting, how the alarms and alarm fatigue causes issues, and altogether it's kind of grasping how can patient care really be improved. And some challenges with reviewing and synthesizing the literature is that there's a lot of statistical data and that can become very overwhelming, along with choosing articles that are cohesive. But these articles definitely seem to have a common goal, and that's just to improve the practice of utilizing telemetry to better patient care. So a practice recommendation would be to make continued education mandatory for nurses in regards to telemetry monitoring. So this would be something that could be implemented to ensure that nurses are having a better grasp of interpreting rhythms, especially even if they've been a nurse for a long time. There may be rhythms that they haven't seen in years and they kind of just go on the back burner. So continued education would really help enhance nurses' ability to interpret and react to rhythms. And the Gazarian article revealed that it is difficult for nurses to manage alarm systems and intervene. So having this education would help them to better manage them, such as changing settings for alarms, and then also knowing when to respond and when it's someone that you need to watch versus like an immediate, like a rapid response. And then the Nakash article actually recommends to have education, that they see that as a way to increase confidence in patient care. And this can be done by online education, hands-on learning, structured guidelines. So the outcome of enhancing practice management would be that by promoting education would be increasing nurse confidence, increasing communication with physicians or providers. Nurses would be more aware or more confident in their and knowing what's going on with their patients, so they may have better communication with providers. And it would just overall increase patient care and safety. So some potential issues to implementing this into practice would be the costs associated. So there would be education costs for having all nurses, have mandatory education in this subject, along with nurses would be spending some of their time off of the floor. So this is an associated cost, plus it can also cause there to be less nurses on the floor, or having nurses need to pick up time to fill vacancies within staffing. And then there's also the multidisciplinary input factor. So in order for, the nurses can be educated, but in order for it to really work and to promote a better patient environment, providers would need to be on board with really understanding who should be on telemetry and who should be discharged from telemetry. So that would be a huge factor in decreasing alarms as well. So key points to remember is that research really does address the need for change in regards to telemetry monitoring. And a big factor is nurses need to increase their confidence with monitoring patients with telemetry orders. And alarm fatigue needs to be addressed in order to promote patient safety and optimal care. So while there are always going to be patients that 100% they really need to be monitored on telemetry, there are some that do not. And being able to have these patients not be on telemetry or have their orders discontinued really can help to solve the problem of alarm fatigue, and also this education that could be implemented would help increase nurse confidence. Thanks for watching.